Welcome to Recovery with Root, a podcast centered on topics surrounding mental health and addiction. Through our Advanced Recovery Institute, a new entity of the Root Center for Advanced Recovery, we are committed to research and training to elevate clinical care. We hope you find this podcast informative, and most of all, we hope that it helps improve the lives of others. Remember, we're in this together, and recovery is possible.
Welcome back to another episode of Recovery with Root. My name is Margot Farrell, Chief of Staff here at the Root Center for Advanced Recovery. And today I am so excited because we have two researchers joining us, because here at the Root Center, not only do we treat patients, not only do we do teaching opportunities, but we also have a lot of research endeavors. So today we are talking about defining outcomes of success in methadone treatment for opioid use disorder, a patient-centered perspective. We have two of our researchers here with us now. Dr. Kristyn Zajac is a clinical psychologist and associate professor at the University of Connecticut School of Medicine. Her research is largely funded by the National Institutes of Health and focuses on peer recovery support services for people who take medications for opioid use disorder. We also have Liz Narwold, who is a four-year medical student at the University of Connecticut. She conducted the research we're going to be discussing today as part of her medical student capstone project. Ladies, thank you so much for joining me.
Thank you for having us.
So I guess we'll just start off, Liz, since this is really your capstone in your project. Why don't we start off with you and tell us a little bit about how you came to decide on this topic and why you wanted to do this research?
Sure. So, like you mentioned, the capstone is a part of my medical school education. So every medical student will do a research project over their 4 years. And when I started to think about it in my first and second year, I knew that I wanted to look into addiction and specifically like opioid use disorder. It's something that I see all the time in my clinic. I've gone to the same clinic for 4 years now, once a week, and I saw a lot of my patients were either on methadone or had different substance use disorders, and I felt like it was a field that is really highly stigmatized and something that I wanted to really learn more about. And specifically when it comes to methadone, I was really curious about we talk about these factors of abstinence and retention and treatment, and I just was hearing from my own patients that that wasn't necessarily what was most important to them. But then I needed a mentor for my capstone project, and so I reached out to Dr. Zajac, knowing that she does a lot of work in this field, and we together kind of came up with what would be the most feasible project for me as a medical student. And kind of leaning on her resources and her expertise, we were able to create this project where I was really focused on what is the patient perspective on success in methadone treatment. And Dr. Zajac plays a big part in our capstone projects altogether. And so, Dr. Zajac, do you want to speak a little bit more to that process?
Yeah, I can give a shout out to our capstone program because it's such an awesome program that is pretty innovative. I'm one of the co-directors of this program, and it allows all of our medical students to have an opportunity to lead a research project during their medical school career, which is hard because they're so busy doing all kinds of things. But so the students get to do a project with mentorship from one of the faculty members. And I'm so happy that Liz came and wanted to do something on opioid use disorder because it's important and it's relevant to so many of the medical students and when they go out into practice as well.
So Liz, tell me a little bit about how you got involved with the Root Center and really how the Root Center was able to help you in this research project.
Sure. So I really relied on Dr. Zajac's connections. As a medical student, I had not really come across the Root Center before. And I knew that I wanted to do this research on methadone and really focus on the patient perspective, but I didn't necessarily have access to a group that I could survey. And so when working with Dr. Zajac and her team, she had already had this close relationship with the Root Center, and it seemed like a natural progression for my study, and really the best way to go about it, because when I really wanted to focus the patient-centered perspective, we needed to find a place to survey people. And so that's where the Root Center came into everything, and it's really the core of my project is the voices of people at the Root Center. And it has been wonderful. We had a great participation. We had 150 participants. I was worried initially that people might not want to do another survey. And so I'm just so happy that we were able to partner with the Root Center and that we had so much involvement.
And Dr. Zajac, we're obviously we're very fortunate to have your partnership. You've presented for clinical grand rounds. You have a lot of involvement with us. What do you think about the Root Center stood out for you as something to maybe suggest to Liz for this project?
Yeah, I mean, Root Center's been an incredible partner for me for the last 6 years, 7 years. I think this is the third or fourth project I've done in partnership with the Root Center. You all just are so open to collaborating with local researchers and maybe national researchers too, and are like very open to like new ideas. You make the process easy. You have Siobhan who helps us kind of navigate things, and so. And the patient population is amazing. They're so willing to help and they're excited to be involved in research studies. So there's something about the climate, I think, at Root Center that lends itself really well to these types of projects.
So I guess let's get into a little bit more about the findings and the research itself. So what did the study look like? What were participants asked to do, and kind of what were some of the findings that you found?
So I'll start maybe by just giving the background a little bit
Mhm.
about why I think this study is so cool, and then I'll let Liz talk about kind of the logistics. But so her project is it had to be relatively simple because it's a capstone project, but it's a simple but significant question, which was how do patients in methadone treatment define their own success? And it really comes from a movement in the addiction recovery science field around making sure that we're uplifting the voices of people impacted by the opioid epidemic. So the technical term for that is community-based participatory research. That's what I did my grand rounds on a couple of years ago. But the idea behind it is that we should be doing our research in partnership with people impacted by the opioid epidemic. So instead of doing research on people or about people, we're doing it really in partnership with them. And so her project comes from this idea that in reality, when you look at all of the research that's been done on medications for opioid use disorder, so Suboxone and methadone, there's this really rich research literature showing that it is effective, very effective. It's our most effective treatment. And in all those research studies, researchers have really chosen to look at abstinence from opioids and reduction in opioid use as their primary outcomes, which makes a ton of sense, right? If our medications work, they should be helping people reduce their opioid use and or become abstinent from opioids. And that's what patients want too. They come to us saying, I need help getting off of these opioids. However, it's really important that we don't lose sight of the fact that that's not the only outcome that's important to patients, and it shouldn't be the only outcome important to us either. And so as a field, we haven't really stopped to ask the question of, well, what's most important to the people receiving these medications? How would they define a successful treatment? And that's what Liz's study really sets out to do. And she's taken this community-based participatory research approach that I'll let her tell you all about.
Yeah, sure. So in terms of the kind of specifics of what we did, the first step was to do a literature review. So just looking to see what outcomes are studied in the research. Like we've mentioned, frequently hear about abstinence and retention and treatment. But we really wanted to start with the literature review to kind of figure out what is being studied. And among the 17 studies that I had looked at, the vast majority did really use retention and methadone treatment and abstinence as their primary outcomes, but with a scattering of other outcomes also included. So starting with that literature review, then we created a list of all the outcomes that were used in research, and presented that to CHEER's community board. So that was really wonderful because we had young adults with lived experience of substance use treatment, and they were able to take a look at that list and see if there's anything that's missing on that list of outcomes that's important to them. They also helped us with just the general formatting of how we're going to ask questions, and they provided a ton of really wonderful feedback on what we should include in our list of outcomes. Then using that list of outcomes from the literature review and the board, the CHEER board, we ended up coming down to 30 outcomes that we are going to ask in our survey. We created a survey that was then distributed to 150 people at the Root Center. And with that, they looked at the 30 outcomes each individually and rated on a scale from 1 to 5, 1 being not important and 5 being the most important. They rated how important those outcomes are to their own treatment and success. And then from there, we were able to analyze the data. I can talk a little bit more about that if you want to go into it right now, or if there's
Yeah,
anything.
sure, definitely. What did you see?
Yeah, sure. So the first thing was to find the averages of all these rated outcomes, and then rank the outcomes based on what were the highest rated. And so looking at the top 5 highest rated outcomes, the first one was continuing methadone. The second one was improving mental, physical, emotional, and spiritual well-being. The next one was stable housing. And then there was also not getting arrested and improving your general sense of well-being. So those were our top 5 highest rated outcomes, most important to the participants. And
Was
then
there anything that surprised you with the research and what the outcomes were?
I think I was constantly surprised by the outcomes. One, the highest rated outcome is continuing methadone. And so that aligns with kind of what we were seeing in our literature review and this idea that retention and treatment is important. And we saw that, that was highly rated among the participants as well. But beyond that, there were a lot of outcomes that were really focused on a more holistic sense of well-being. So this idea of generally improved emotional, spiritual, mental well-being came up a lot. And so I think that's something that was, definitely surprising and interesting to me, that really this kind of general sense of well-being showed up over and over again as being very important.
Dr. Zajac, what do you think of, the findings with this research and what this maybe means for the future of treatment?
So I think this has really important implications for how we do our research and how we're evaluating whether our treatments work, right? So I think this is telling us that our patients are saying these holistic outcomes are much more important. To some extent, I mean, some of the time they're also saying abstinence is important and keeping with treatment is important, but not only those, these other things too. And so when we're designing research studies where we are evaluating whether treatments work or medications work, we really need to be measuring things beyond abstinence, beyond retention and treatment, and more holistically, how is the person doing? Not only are they surviving and getting to a state of recovery, but are they thriving? Are they living fulfilling lives? Are they reconnecting with family members? That's really important, not just for the research, but then also in our treatment centers, right? And I think Root Center does this a lot already, but like, are we asking patients not just about how are they doing with their substance use, but how are they doing with their family? How are they doing with their housing? How are they doing with their spirituality, their mental health, and all those other things? It highlights that that's important, which I think we somehow already knew, but I think this puts it on paper and shows us with numbers that we need to be doing this in a better way.
And Liz, where do you go from here with this research? Now having completed this, what's kind of next steps for you and where you are?
Sure. So overall big picture, I'm going into family medicine next year. And a big part of primary care and family medicine is being someone who, a big part right now is being able to provide MAT, being able to provide medications for opioid use, and really being that person for these patients that can help them kind of navigate this. And I think understanding the patient perspective is always incredibly beneficial to physicians, no matter what, but specifically in this field where people may have distrust in medical providers and they're dealing with something that's highly stigmatized. Being able to understand that there is so many other important things other than just abstinence from substances, I think is really going to benefit how I approach communicating with my patients and really forming a partnership with them. And so, that's my goal, to be a general primary care provider who can also do a lot of work in the kind of addiction field.
And do you see, were there any, kind of setbacks or challenges? I mean, you talk a lot about the stigma, the discrimination that can certainly pose a challenge when, working with this population, when researching this population. Did you come in contact with any challenges along the way that made you maybe reconsider things or shift how you were focusing?
I think one thing we focused on a good amount while creating the survey was, how are we wording these questions? And wanting to make sure that we are not perpetuating stigma in the way that we're wording questions. But we also had an open-ended section of the survey, and we found that people were submitting answers using language that we were like avoiding. And I think there was just some really interesting ways of like, we were trying not to perpetuate any stigma. And but I think otherwise, having the Root partnership, like I mentioned, we had so many more participants than I thought we would. And the only other thing that I thought was challenging was analyzing some of the data, especially the more open-ended responses. It just comes down to trying to understand what the person is sharing and making sure I don't miscategorize it. I'd say those were the more challenges, but nothing like really significant.
Mhm.
And I
And
think
Dr.
one of- I'm
I
sorry.
was just going to say, Dr. Zajac, in your experience, what would you have to add to that?
Yeah, and I think one of the ways that one of the ways Liz approached this to kind of circumvent some of those challenges was to partner with our community board. And Liz said CHEER before. That's short for Collaborative Hub for Emerging Adult Recovery Research, which is why we call it CHEER for short. But we have these established community boards that we can go to, and those folks have lived experience with medications for opioid use disorder, and so we can go to them and say, "Are we asking this in a way that's stigmatizing? How can we ask this better?" And they were so helpful. And so when we got to the point where we're actually showing the survey to research participants, we'd already had a group of people with lived expertise kind of vet everything for us, and it made Liz's research study so much stronger.
What do you think is, the outcome here that shows maybe what our prospect is for the future, given the results that Liz has found?
Good question. Say that again.
How do you see this being implemented moving forward?
Oh, well, I am immediately going to be implementing it in my own research and making sure that every study that I do has much broader outcomes that we're looking at. I also think, I mean, I think there are many clinics that are already kind of asking more holistic questions about patient outcomes, and we should be looking to make sure that all clinics are doing that. I think Liz kind of touched on this, but I think when someone's asking you not just about your drug use and giving you a urine screen and asking you about abstinence, but actually asking you, like, how are you doing? Like, how are you feeling? How is your life? That actually goes a long way to kind of breaking down some of the stigma around opioid use disorder. Because you're not just a patient, you're not just someone who's struggling with an addiction. You're a full person who deserves to have all of these amazing outcomes after during your recovery.
Is there anything else that you'd like to add about the study that we haven't covered?
I just kind of going off of that a little bit, I think there were some interesting write-in responses when it came to so in addition to our rating system, we also had a question that was saying, what is the most important outcome to you? And then also, what has not been included in this list of 30 outcomes? So first, in terms of outcomes that weren't included in our list, I think one thing that came up a lot was parent-child relationships. I thought that was a really meaningful additional outcome that I hadn't thought of. And then additionally, avoiding any sort of negative influences like old places or people who might not be a great influence on you. And that came up in a lot of responses. And then additionally, I think with our single most important outcome, there was a lot of variability. About 44% of the group said that abstinence from either opioid use or all drug use was their most important, but the other 60% really ranged from family and relationships. There was a lot of I'd say like importance of work and purpose and education.
Housing was one too.
Housing was a big one.
Makes sense.
So just to keep adding on to this idea that there's like so much more to treatment than just to outcomes. I thought that was really meaningful.
And Dr. Zajac, I guess just, to wrap things up, maybe speak to a provider who's watching this, or someone who's about to enter treatment, and what you would want them to know that you found positive, maybe encouraging or inspiring from this study.
Yeah, I think what I found inspiring is, well, I don't even know what's inspiring. It's just that we're kind of actually listening to people and hearing that they're telling us, I have all these other things, all these other dreams post recovery or during my recovery that are important to me. And I mean, I think there's so many amazing providers out there that are already focusing on the whole person. But if there's ways that providers can think about, like, how do I expand my thinking even further? Like, what else might I think about with my patients in terms of, like, not just getting them through their recovery process, but like, how can I get them maybe schooling, maybe job training, maybe other kind of opportunities. Housing obviously is a big one. But then how do I get them to be a thriving person after all of this, after they get through their recovery? Again, I think there's a lot of providers out there that are already thinking this way, but let's keep pushing our thinking in that direction.
Is there anything I didn't touch on that you guys would like to add, or did we pretty much cover it all?
I think we covered it all. Could I do some shout outs and you can cut them out if you
Absolutely. No, we love shout outs.
Well, I already mentioned this, but we really want to thank the Root Center for collaborating with us on this project and all the research participants who agreed to participate in the study. I want to acknowledge the funding for the study. So we're funded by the National Institute on Drug Abuse through the Helping End Addiction Long-Term Initiative, which is part of the National Institutes of Health. And it funds our study called the Collaborative Hub for Emerging Adult Recovery Research, or CHEER, which is a community-based participatory research initiative that helped Liz on the study and does a lot of amazing other things. We had two research assistants, Ruth Fetter and Trish Lozier, who worked on the project, and undergraduate research assistants, Sharpista and Ayed Sayed. And then I don't know if anyone's interested in learning more about CHEER or community-based participatory research. I mentioned we have community boards. We actually have some open slots on our young adult community board. So this is anyone ages 18 to 28 who has lived experience taking medications for opioid use disorder. And our website is www.cheer.org. It's CHEARR.org.
We will be sure to get that into all of the notes on this podcast so people can follow up. Ladies, we really appreciate your time and your insight and obviously your collaboration with the Root Center.
Thank you, Margo.
Thank you so much.
Well, we hope you enjoyed this episode of our podcast, Recovery with Root. As always, stay connected with us on social media to learn about when next podcast episodes will drop. You can comment, ask questions, even let us know about future topics that you'd like to see discussed. Until next time, remember, progress is the destination.